Hi, I'm Colleen. I'm the Respiratory Educator here at the clinic. As an asthma educator, a couple of things we're going to do today. We're going to kind of go over what it means to have a diagnosis of asthma, since that's new for you. And we're going to go through your inhalers, give you some information about what they are, what they do, how you use them. As asthma educators, obviously we are around the province of Alberta, so we're in various settings. So I'm just fortunate enough to be here with a lung specialist clinic, but we certainly have access to us in pharmacies and through your family physicians as well. So just so you know that for future reference. All right, let's just start with a bit of information about asthma to start with. So, I mean, it's not uncommon to be diagnosed at the age of, that you are. Obviously, we have a variety of ages with this lung condition, so it can be kids, adults, seniors, all ages. So that is not unusual to have a new diagnosis at your age. Going back into just looking at a bit of history on you, is there anybody else in the family that has asthma?
You know what? My dad did, but my mom didn't, so.
Yeah, so sometimes people ask me if it runs through the family, so sometimes it can, but again, sometimes it isn't either. So it's not uncommon either way to have that kind of history. We just like to know because sometimes there is a little bit more history associated with your allergies and things like that. So that's good information to know. When it comes to asthma, there's a few things that's really good information to just understand. So it is a disease of the airways themselves. So in looking at my information sheet here, you can kind of tell. So I always say your airway starts right at the top, nose, mouth, and then it goes down. So we have our upper airway and lower airway. And I like to think of it as one big airway that we have to kind of manage as well. So in terms of your upper airway, do you have any kind of nasal congestion or any issues with your nose?
No, I wouldn't say so.
Nope. Okay, perfect. So then if we look and further down, when your breathing goes down your it goes into your left and your right lung. And so the airways themselves, when it looks at asthma and not asthma, can have a little bit of difference associated with it. So I like to start with what is normal and what's really healthy airway. So again, our healthy airway would look like this model itself. So if I was to look inside your airway and take a little scope and look down there, what I would want to see is something nice and pink and very open. So that is where the air will move into. And our airways certainly are not this big, so more the diameter of a finger when we think about it that way. The outside of our airway have all these bands of muscle, and these bands of muscle give a bit of stretch to that airway. Okay, so that's a really healthy looking model. If I look at somebody who has been diagnosed with asthma, and a diagnosis usually takes place by having a breathing test, which I know you already have done, then what happens when you get into trouble is your airway does change. And the change can be very subtle. Usually it starts on the inside of the airway. So you can tell the difference here between my models is that one has a lot of redness to it. And that redness is swelling or inflammation. And you may hear those terms a bit. And what it means is the cells inside, they get a bit angry, a little bit upset when they're exposed to different things. And it does make the lining of that airway get a bit thick. And that's where that thickness happens. So if I've got a lining that gets thicker, that's where mucus can kind of come from. So we might get that bit of, like you mentioned, a bit of a cough or a bit of guck in there, back of the throat as well. So that's where that is developed from. But also you can tell that the diameter of that airway starts to get a little bit smaller. So sometimes we don't necessarily feel this part of our airway, but what we do tend to start to feel is if that muscle starts to get tight. So that leads us to kind of thinking about what kind of symptoms that you end up developing because of having this diagnosis. So tell me a little bit about what kind of symptoms you have. What have you experienced?
Sometimes I'll get a bad cough, and it feels like I can't get enough air down. It's like it feels tight in my chest, and it's very uncomfortable.
Yeah, for sure, and a little bit scary, I'm sure, right?
Causes a little bit of panic.
Yeah, oh, absolutely. When you can't breathe, it does kind of get in that way. So up to now, have you been able to manage with it, or what have you done to kind of help yourself? Anything really?
I don't know the best way to do it. Like if I'm exercising, that's one. Like if I go to the gym and I'm running, I find I can't go as far as I'd like to. So I'll have to sit down and take a breath, and sometimes I'm so tired I don't want to do it again. I just want to give up.
Okay, so you feel a bit limited,
Yeah.
right? No, and I understand that totally. And that is common, again, common symptoms. So what we usually do see can be that cough. Nighttime cough too can be, so you might be sleeping and still coughing in the night, so that's quite common. And again, that chest heaviness. And sometimes people will report getting wheezy, kind of hearing themselves get a bit of a whistle sound, and especially when it's quiet. So again, that nighttime thing. So those are definitely common symptoms of asthma. So again, that is because that airway has changed. And so sometimes that change lasts for a long time, and sometimes those symptoms kind of continue, or sometimes you might notice that it gets a little bit better when you stop your exercise, for example, or if you remove yourself. So that's where we think about triggers. Like, why does this happen? Why are there days when I feel really good, and why are there days when I don't feel good? And that comes to the idea that we have something that you've been exposed to, that you've done, that have triggered this whole change that happens to the airways. Okay, so triggers can be a variety of things as well. So they could be just within your own home. So I guess I'll say the most common one might be animals. So do you have any pets?
I do. I have a dog.
Yeah.
I don't really feel like I can't breathe when I'm around him, but if I'm around cats, I find it gets a little more, like, I feel like my eyes swell a little bit, and my nose and my throat, I feel like I'm getting a shortness of breath a little bit.
For sure. And so, yep, animals can definitely be a little bit of that trigger point. And you know, we have pets, so it's hard to think about that, but yes, for sure. Animals such as cats, dogs, even rabbits, that people, or birds that they have in the house could be typical scenarios. So that's one. The other ones that we might not think of, I think animals are a big one. We can think about is even the common cold. So for you, have you ever noticed that a cold for you lasts longer than maybe somebody else in your own house?
Definitely, yes.
Yeah, yeah, so that's another big one. So common viruses that we all can kind of get. For somebody who has been diagnosed with asthma, it might lead to those symptoms, again, being a little bit more lingering to that airway, because that airway has a bit more opportunity to change. So definitely common colds. And then we have to think about other things that we could be exposed to. So in this day and age, we could be exposed to cigarette smoke, or a variety of different smoke. Last few days, wildfire smoke, yes, right, rolling in. And so when they talk about poor air quality on TV and mention that, that is specific to people who have been diagnosed with asthma or other lung diseases, to kind of watch themselves a little bit more, because they're definitely, poor air quality can lead to, again, changes. And then the other thing, seasonal. So again, pollens, those kinds of things. So spring might be worse than summer, fall, winter. So all of those seasonal changes can be another trigger for some people. Have you noticed any difference for you depending on the seasons of the year?
Spring, when everything's coming up and everything's flying around.
Yeah, yeah, for sure. Pollen count is really high, right? We start to have new grass coming out. People are, you know, raking their grass and all that kind of stuff, for sure. And then the other things within your own home might be dust. So again, if we got a dusty environment, depending on the nature of your house, how old it is, if you've got carpet in the house versus hardwood floors, all these kinds of little pieces. So the idea around triggers is just trying to at least think about it a little bit. And I think through just this conversation that we had, it just makes a person think a little bit more about, what am I exposed to? Maybe think about when my symptoms are worse, and maybe it is associated with the room in the house, if you've moved recently, if you're in school, and what kind of classroom you're in. So there's just a variety, workplace environment, a variety of things to think about. If you really know that there's something specific that flares you up, maybe try to avoid it as best you can.
Makes sense.
Yeah, and there's lots of information that's out there about if there's things in the home, like ways to really clean up a bedroom, or you know, it can get expensive to look at triggers in a different way, especially if you think about carpets versus hardwood floors and things like that. It can get expensive, but it's just good knowledge.